Okay. Well, thank you. Thanks for having me on here, and thanks for interviewing. I'm excited to talk to you. So I wanted to hear a little bit about just kind of your background, what got you into PT, and how did you end up here?
Oh, man. It's a long story. I was studying to be an architect.
Okay. It's a big change.
Yeah. Everybody told me in high school that you will change your career 3 times in your life. And I was like, not me. Like, I found my passion,
Yeah.
right? And then I tore my ACL.
Okay.
And I went to physical therapy.
Yeah.
I was like, wait a sec. You get paid to do this? And everybody there looked at me like I was dumb. But I was like, you guys, I do this for free. This is fun. If somebody's hurt, you're like, let's get back to moving.
Yeah.
This is amazing. So I dropped architecture and switched over.
Cool.
It's like, this is what I have to do. I found an internship, started getting training, started doing all the background stuff. I got way into medical.
Cool.
Studied podiatry, I was looking at being an EMT.
Okay.
And dove all in.
Cool.
But PT was really, along the way as I'm learning, it was my thing.
Cool.
I shadowed orthopedic surgeons.
Cool.
That made me queasy. I got to watch 4 surgeries.
They're brutal.
Oh, yeah.
Yeah, it's insane.
The first one, I'm like, this is so cool.
Yeah.
And then the nurses grabbed me and threw me in a chair. And I'm like, what? What's wrong? And they're like, you were about to pass out. I had no idea. And so we walk out. They're like, did you eat yet? And I was like, not really. Like, I just...
Yeah.
I don't know. I just eat whenever I eat. And they're like, they gave me a lunch. They're like, eat this. And they gave me a second one. They're like, eat this because we had more surgeries.
Yeah.
Anyway, super fun getting into medical, seeing everything. And PT is the best career. Just love it.
That's amazing. So, I love that. So how did you tear your ACL?
Playing soccer.
Soccer.
It's a really good story.
Okay.
I scored.
Okay.
That's what matters.
That's what matters. Right? That really is. Yeah.
I jumped in the air, and it wasn't like a bicycle kick. I kicked it sideways.
Okay.
And when I came down on my left leg, it bent backwards.
Oh.
And so I fell to the ground, held my knee, but I kept my head up to watch the ball. And once the ball hit the back of the net, then I just held my knee. So I was pretty happy I scored.
If you're going to get hurt, at least get a point with it, right?
Exactly. No. Like, it had to be for a reason.
Cool. And that's a very long recovery as well.
Yeah. It took a long time. First off, I just didn't do anything about it.
Okay.
Right? Took me about 3 weeks of hobbling around to finally get over the swelling and everything. Yeah. And I got back where I could walk and do whatever I wanted. It was 7 months later where I'd go and play basketball, but my knee would jerk on me all the time, or playing soccer or whatever. It was super unstable.
Yeah.
Finally, I went and saw an orthopedic surgeon, and he's like, yeah, you have no ACL at all.
Dang.
And scheduled surgery. And
wow.
Yeah, it was a long recovery. But when I went to PT, even though the environment was amazing, the idea was amazing, I switched my career because of this.
Yeah.
The PT I was with was terrible.
Okay.
In a hospital setting.
Okay.
Right?
Yeah.
5 minutes with the PT, day one. Never saw him again.
Yeah.
Like, didn't even see his face. The people I worked with were techs.
Yep.
And they'd tell me what to do and what to work on, and they'd measure my knee, and they weren't skilled. They weren't a PTA or a PT.
Yeah.
Super annoying.
Yeah.
And they put me on a bike. I was doing this hamstring curl thing, and I felt a pop, and it was painful.
Oh, man.
And so I just stopped, and I asked one of the techs, and they're like, 1 sec, and they go in this room. The blinds were closed. They go in this room, close the door. Like 10 minutes, maybe waiting for him to get off the phone or something. I have no idea. Comes back. He says, you're fine. How does he, like, he's not here. I was so annoyed with that.
Yeah.
So annoyed. So at that moment, I was like, I'm doing high quality time spent with the patient care.
Yeah.
People are paying a lot to see a physical therapist.
For sure.
So that's really where a lot of it stems from. And once I graduated and got into practicing, seeing 3 or 4 patients an hour, it was terrible. I knew I had to open my own business.
Cool. I love that. I do feel like there's so much of that right now, right? Like obviously reimbursement rates is a struggle for everyone, and it becomes this patient mill. Like how do we get through everyone? And patients end up often suffering because of that. And not that there's clear answers, right? I mean, it's hard for businesses to stay open right now too, but patients suffer from that.
And you get what you pay for, right? If you have United Healthcare, then you should only get 10 or 15 minutes with the PT.
Yeah.
Because that's all that they pay for.
Yeah.
But if you're in a car crash, they pay enough that you should be one-on-one with your therapist. Like it pays really well.
That's true.
And so it really depends on what there's a whole ethical discussion we could dive into.
Totally.
Where it's like every patient deserves the same quality of care. They deserve it, but if they're not paying for it.
Yeah. It's like the business side versus the patient side. And like it's both are valid and both have to be balanced out in so many ways.
Yeah.
So, and that's what you specialize now in a lot more, right? Is motor vehicle accidents.
Yeah. We only work with auto accident, workers' comp, and then self-pay stuff. Okay. I totally respect the PTs out there who have to do it the other way, right? Totally. Everybody needs help.
Totally.
And if you have United Healthcare, your PT will likely have 2 other patients at the same time.
Yeah.
It's because the clinic can't stay open.
Totally.
They will go under.
Yep.
But we wanted to give people a different option.
I love that.
Where you get one-on-one with your therapist. And so we had to go with those specific payer groups.
I love that. That makes sense. So. And what do you feel like you see in those specific type of patients in terms of even just their experience of going from this accident to getting through to you guys and kind of working through you? I mean, where are they at in a headspace, do you feel like?
Well, that's what made me most excited to talk with you about this. So my whole career, even in those first jobs where I was seeing several patients an hour, I did a lot with workers' comp.
Yeah.
And I found a passion for it for a couple of reasons. Often I'm a little bit of a rebel, so people say this is terrible, so I'm like, I want to see. Is it really, right? Yeah. Yep. Workers' comp is terrible because everybody who gets hurt at work is lying. They're faking an injury. I'm like, oh, really? Okay, let's go. And so I dove into it, and they're not. Yeah. By and large, most are not faking it.
Yep.
And when they are, PTs are trained to recognize faking, right?
Yep.
But most are not, and they're getting turned away. They're getting told that they're lying, that their pain isn't real. Yeah. I've had it as bad. I hope this is appropriate to talk about, but I've had it so bad, as the medical provider said, this is a Hispanic woman, so she's clearly exaggerating her pain.
Oh, man.
And I was like, you were sexist and racist in the same sentence.
Yeah, that's infuriating.
That's insane.
It's wild.
Certain cultures experience pain or express pain differently, sure.
Yep.
But to just brush them off, she's not injured, is just naive, I think. Anyway, so that gets into the psychology.
Yeah.
And the coolest part for me is people who get hurt at work and they think, this is dope. I get paid to sit on my couch and play video games, right? When I was 23, I would have loved that. Halo, Call of Duty, let's go all day long. And I'm getting paid. This is awesome.
Yeah.
And then after 3, 4, 5 months, it's super difficult ever get back to work.
Yep.
It destroys you mentally.
Yes.
You have to keep working.
Yeah.
There's a company out there, at least one, I'm sure there's more, but there's at least one company that will give people a job to do for light duty.
Cool.
So if they work at a construction site, there's no such thing as light duty at this specific site.
Yeah.
And the company's like, we have nothing else. Send them to them. They'll have them make calls, have them work on a computer where it's light duty.
Cool. I love that.
And it gives workers a chance to stay at work, stay in the right mental space. I have worked with loads, because I do all this home health, right? I've worked with loads of people on permanent disability for the last 35 years.
Oh, man.
They're miserable.
Yeah.
Not a single one of them is happy that they made that choice.
Yeah.
And so I try to teach my patients who seem to be headed that direction, right? Yeah. Or anybody, auto accident, workers' comp, talk to a psychologist. Let's get the mental health part in it.
Totally. I love that so much. And yeah, I mean, I do feel like so many people do get in that mindset of, oh man, you won the lottery, you know, in a car accident, workers' comp. And as someone who's been through a workers' comp case, that's so out of that's just not true. That's just not the reality at all.
And yeah, you might come up on top on certain things here or there, but really what you're getting paid for, like in an auto accident case, is the pain and suffering.
Yeah.
Because for 6 months, you didn't go rock climbing like you would have been.
Yeah.
Sure, you're sitting at home watching TV and you're fine.
Yep.
But you missed out on rock climbing. And then how long does it take you once you've recovered to get back to your normal? Yeah. And do you get back to that?
Yeah.
Are you going to get back into that if nobody pulls you into it?
Definitely.
Sometimes, yeah. Sometimes not at all, and it destroys their life.
Definitely. Well, and I love an important other concept I think you touched on was the providers with it. I think there can be such a bias that comes in with that. And I've experienced that. So my injury, I got a bilateral hand injury on the job almost 3 years ago now, or a little more than 3 years ago. And initially the providers, they were like, oh yeah, you're fine. Like you'll be fine. It's workers' comp. It's not a big deal, and I'm now 8 surgeries later in my hands in 3 years.
It's just miserable.
Yeah, it is. Right. And then it is this perception of like, well, are you just in pain because you're wanting to get paid? It's like, I don't benefit from this. Right. Like I would be benefiting from doing what I love, from being back in my job, yeah. Right? And not to say there's not any benefit to workers' comp, but like what you lose is so much greater than what you get. And the bias that comes in with a lot of providers, I experience that. I know a lot of our clients experience that. And it's very frustrating for them, right? They're like, I just want to be taken seriously. Like just because you see workers' comp next to my name,
right.
Like that doesn't change my condition, right?
Yeah.
And I don't know. I mean, what are your thoughts on how to work through some of that?
I think education, really it's just like how I feel like in the last 10 years, mental illness has been more recognized.
Yeah.
Right? 10 years ago, you're depressed, so choose to be happy.
Mm-hmm.
You're depressed, go outside. Mm-hmm. And now there are things you can do, right?
Of course.
Vitamin D, be outside. There are things.
Definitely.
For sure. But it's recognized. People are supporting people. And same thing with this is I'm hoping that we can get that shift by being an example, right? By having podcasts that educate people.
Definitely.
That they aren't all faking it.
Yeah.
And pay attention, right? As a provider, it's our job to write statements of causation.
Yeah.
Someone's in a car crash and 8 miles per hour and they're their injuries just don't seem to line up. It's our job to pay attention.
Of course.
But believe them at least in the beginning, right?
Definitely.
Give them a chance. Get multiple opinions. Don't ever think that you're so good as a doctor that I know you're faking this 100%. When I think someone's faking it, I recommend that they get a second opinion.
Definitely.
Right?
Definitely.
There's one story. Can I tell a quick story?
Please do.
So I was working at Grantsville.
Okay.
And this lady comes in. I was treating her dad. She brought him in, and she just loved how good I was as a therapist,
awesome.
Right? So I think that may have been a motivator behind this. I don't know.
Yeah.
But she comes in with a work injury for her shoulder.
Okay.
And she's like, I'm like, hey, lift your arm for me. She's and just like can barely move it.
Yeah.
And I'm like, man, that looks like that hurts so bad. And
yeah.
I do some other tests and I can tell she's not trying, right?
Mm-hmm.
Like we have tricks.
Yep.
Right?
Yep.
And I'm like, hey, you got to actually try. She's like, I am. This hurts so bad. I was like, okay, well, I'm not going to tell anybody that your pain's not real.
Yep.
Right. But I am going to document that I'm seeing inconsistencies and certain other things that I have to write down.
Of
and
course.
I reach out I'm planning to reach out to the insurance and say, you need a second opinion on this.
Yeah.
Right. Well, she puts on her jacket, lifting her arm up in the air and just fine.
Yeah.
I think it was her left arm. Because then she gets out to the car. Her dad's riding it's Grantsville, right?
Okay. Yeah.
He's riding this little, not a motorcycle. What's that called?
Moped thing. Yeah.
Like tiny. Big guy on this tiny thing. I love the guy. So funny. Well, she gets in her car and then sticks her arm all the way out the window up in the air and flips him off. And I was like, hey, putting on the jacket, flipping him off, zero pain. And you're sitting here, I can't move. I'm like, okay, I don't even need a second opinion on this.
Yeah, I feel pretty confident here.
So there are those stories, but they're rare.
Yeah, I agree.
Right?
They're few and far between. Yeah.
And if you can help them, they get back faster. When you work treat the person as a whole.
Agreed. Yeah.
What's their lifestyle? What other trauma do they have going on? And help them get back to, all of us want to live life and feel like we contribute.
Definitely. No, I love that. And I think something important that you mentioned as well with the providers of, again, education and getting a second opinion back to the patients as well, is if you don't feel like your provider's taking you seriously, like go get a second opinion, right?
Yeah.
And like you're never committed or stuck to a provider. And I think it's so easy to get in that mindset that you're kind of stuck or committed to a provider.
Go work with someone. This person or nobody.
Yeah.
That is my second obsession.
Yeah.
So you're hitting on both of my two obsessions. One is take people seriously. The second one is freedom to choose. There's a better way. Patient advocacy.
Yeah. Yeah.
You get to choose.
You do.
I tell every patient I see for auto accident workers comp, I tell them right away, you can go wherever you want.
Yeah.
I try to word it in a way that it doesn't sound like, please go away, right? Yeah. Like I'm not saying that.
Yep.
But I want you to know you get to choose. Yep. Most businesses won't tell you that because they don't want the chance that you're like, oh, really? Well, there's this other PT that's closer. I will help you find somebody.
I love that.
And one of my pet peeves is there's certain groups out there called One Call and MedRisk.
Yep.
Who will call the patient,
tell
the patient, if you go to Mint, your care won't be covered.
Oh, man.
Which is a lie.
Yeah.
So we try to educate patients beforehand. Sometimes they're just so scared, right? Which is fine. I get that.
Yeah.
But they think I have to go where they tell me to go.
Yeah.
It's like, no, they just want to make money off of you.
Definitely.
So I'm a very big advocate for that.
I love that.
And I've fired a couple patients because I wasn't the right fit.
Yep.
And I've been fired by a couple patients. And I'm like, awesome.
Definitely.
I'm so glad that you told me instead of just sucking it up.
Of course.
Like, tell me.
Agreed.
The only reason I'm here is for you.
Agreed. I love that so much.
Yeah.
Yeah, I know. So after my hand injury, so mine was a fall, and so I broke both my wrists. I broke 6 bones total between both hands. And I went to the ER, right? And they were like, oh, yeah, I think you got a broken bone in each hand. Wrap it up. Go off. Well, go visit like a med risk doctor or like a workers' comp.
Yeah.
You know what I mean? And I was like, I don't know about that. And one of the other providers comes in. He's like, yeah, just some general orthopedic. Like, you'll be fine, right? And one of the nurses comes in. She's like, go to a hand therapist, right? And I was like, I love that nurse. I'm so grateful for them, right?
Yeah.
And even reaching out workers' comp. No, go to this specific provider. It's like, no, I'm going to go to a provider that's going to be good for what's going on with me, right? And they don't make it sound very optional from at least a patient perspective, right? And so
we have to be advocates.
Agreed.
Tell them that it's an option.
Agreed.
Right?
I love that. Yeah, because they don't have that information oftentimes. So yeah, and they get with providers who aren't the right fit for them. So and sometimes again, providers aren't going to be the right fit for a patient. And I feel like sometimes this becomes an ego thing for them. Like a provider wants to be right for every patient, and it's like it's just not always the case, right? It's like I don't expect to be best friends with every person I meet. Not that you have to be best friends with your patients either, but you're just not always going to match your vibe even with the people that you are working with all the time. And I think that patient-doctor relationship is massive, which a very common thing we see is people's faith and belief in a treatment really does impact the way that they heal and they get better. Have you noticed that at all? And what are your thoughts on that?
Yeah. Placebo is your best friend.
Yeah.
Right?
Yeah.
And you can dive into it really deep, right?
Yeah.
If you're like, well, it's unethical to give placebos. No, it's not.
Yeah.
What was the outcome?
Yeah.
What's unethical is to give them a sugar pill to treat their cancer, and the cancer doesn't get better, and you're like, well, keep taking the sugar pill, right? So if I'm giving physical therapy to someone with a blown rotator cuff, and it's not getting better 6 weeks in, don't say, well, it's going to take 6 more months. Let's keep going. That's unethical,
Totally.
right?
Agreed.
But placebo, what if you have cancer and you take a sugar pill and the cancer goes away? Well, it was a fake treatment. It was a sugar pill. Who cares? The cancer is gone.
Yeah.
Right?
Yeah.
And there's so much power in we actually don't even comprehend the power in our brain.
We have no understanding of it from a medical perspective, I feel like.
100%. You can actually, this is one of my favorite things I'm studying right now.
I love it.
Self-talk, affirmations, all this. There's a lot of power. I work with a lot of patients who have PTSD and issues from sexual trauma or whatever, because headaches and migraines is my specialty.
Okay, yeah.
And so self-talk that I'm not worthy or I'm worth nothing or all this negative stuff tears them down and makes them hurt and makes their fight or flight system on high alert.
Yeah.
Fight or flight system, sympathetic nervous system is on a high alert. You can't heal.
Definitely.
Right?
Yep.
You can't heal.
Correct.
Then you get this chronic stuff and you think it's your fault and you're broken. We want to empower you. When you're empowered, when you self-talk positively, then you're going to win.
I love that. Yeah.
So, but like I said, we could go in deep on that.
Yeah.
Let me bring it back, though, to placebo.
Yeah.
The research shows if it's a good treatment, that helps. If the patient believes it's a good treatment, that's even more important. And then if the provider believes it's a good treatment, also matters.
Oh, yeah. I
so
never thought about
placebo isn't, it's not real, but you're pretending it is.
Yeah.
A real treatment
Yep.
can have placebo effect.
That makes sense.
So is eating healthy going to help you lose weight? Yes. What if I eat healthy and I believe it will help me lose weight? Even more. That's placebo, in my opinion.
Yeah.
I'm not a pain science specialist,
yeah.
but
No, that makes sense.
If you believe it and your provider believes it, you have a better chance of getting better. I really believe in dry needling.
Okay. Yeah.
And when my patients also believe in it, they have a better chance that it will work.
That makes sense. I see that. I mean, why do you think that is?
That's a good question. Why does that work? I don't know.
Yeah.
It's a really good question. I don't know.
Mysteries of the mind.
Yeah, it might just tie into the power of our mind, right?
Yeah.
When our brain lets those things happen.
Yeah.
When I tell myself that my wife and I are going to fight, then we're more likely to fight. When I tell myself my wife and I get along, we're so good, here's a problem we have, we're going to figure it out together.
Totally.
It always goes better.
Yeah.
I was interviewing on KSL.
Cool.
On my way there, love public speaking. I love this stuff.
Cool.
But still, it's a camera, right?
Yep.
So you're like, the whole way there, I was like, this is going to go smooth.
Yeah.
I'm not going to say and I'm going to be positive. I'm going to be on point.
Yeah.
And I just said positive stuff.
Cool.
I got there. Whole thing went smooth. And I walked away. I was like, who was that?
Yeah,
That wasn't me.
That was not me.
It was incredible.
That's awesome.
So positive affirmation, placebo in your own life. Do you know what the opposite of placebo is? There's a word for it.
I don't.
Nocebo.
Okay.
It's a real term.
Okay, that makes sense.
It means the exact opposite. It's placebo for negative.
Okay.
So if you're like, man, this is going to hurt so bad, it's going to.
Yeah.
Right?
Yeah.
And so you can say, I'm going to fail my test. You're more likely to. If you say whatever, nocebo effect.
Okay.
And you have to be careful as a provider because you can cause that on your patients.
I could see that.
Like you are going to hurt so bad tomorrow after doing these exercises, but you have to do them.
Mm-hmm. You're going to make that.
You're setting them up for failure.
Yeah, I could see that. Makes sense.
Have you read any of the studies on MRIs and the negative side effects of an MRI?
I have. It's so interesting.
Psychologically, right?
Yeah, it's so interesting.
So cool.
It is wild.
And I think it's nocebo.
I could see that. Yeah.
And now I see an image of my spine with a bulging disc. Is that bulging disc causing a problem? Maybe.
Yeah.
Whether it is or not, it's what the patient believes when they see that.
Correct. Yeah. When they go in and the provider tells them, oh, you're bone on bone in your knee, like automatically, like now, they have that belief of what's going on and that potentiates issues. Yeah. And I feel like so much of it in recovery and rehab as well is all about our perception of better and worse is so relative, right? Like there is some objective measurements that we can do with better and worse, but they're very limited in the grand scheme of things, right? Yeah. Especially when we're looking more functional use. And so I think as patients believe, I am getting better, we notice what is actually improving better. Oh, I could do that easier. Oh, that didn't hurt. That usually does, right? And I think so much of that belief in treatment is about noticing the improvements, where even if we're not believing the treatment will work, there may still be some of those improvements, but that's not where the attention is really getting drawn to as well.
Well, and that's why I like physical therapy so much, because that's, I'd almost say that's half our job. Mm-hmm. I got hurt, I tore my ACL, I got 6 surgeries on my hands, and I watched a YouTube video that said I should do these things, but it hurts to do it. But then I do those same things with a PT, and the PT says you're safe to do this. It's like, okay, good. Like, we know you're okay to do those things.
Yeah.
You're not going to make your injury worse.
Yeah.
And it's so fun to guide people on that.
Yeah. Building that confidence back in body, I think, is massive. And such a big part of PT's job is just building confidence back in movement and trusting the body again. I mean, what are some of your thoughts on that, or processes that you go through to help people re-trust their body?
Yeah, there's a balance, right? First, as the PT, you have to actually know how injured they are so that you don't hurt them more, right? Yep. First rule, do no harm.
Yep.
But if you know what their hurt is, you know what's safe, then challenge them and get them to try it and help them realize, oh, I'm okay.
Yeah.
Right? They can tolerate a lot more than they realize.
Yeah.
They have to try it. And being the expert that knows how much pain should be tolerated, or how much should you experience, or what pain is safe pain.
Yeah.
Helps people be like, okay, I can try that, right? And somebody's doing it. Is this normal? Should I be feeling clicking? Should this hurt? Yes, it should. How much does it hurt? Like a 3. Okay, good. You're fine.
Yeah.
If they're like, should this hurt? It's like an 8. It's like, oh, let's stop.
Yeah.
Right. Yep. And we're adjusting based on the person. But what does the injury tell us first? And then after that, what can they do and psychologically handle? Yeah. And then push them a little bit. But you got to gain their trust. If they're going to trust you to know, am I safe to do this, right? They need to earn that trust.
I love that. That's amazing. And I feel like a big thing that, I've noticed in people who come in through our organization, right? They come in and they're like, well, they said, oh, return to whatever you want to do. But like, I don't know, like, it hurts. I'm scared. Like, what if it happens again? It's such a common thing that we see. And they end up, whether just not doing things or still relying on other people. Well, they said I could do this, but I'll just have my wife do it for me still, right? Exactly. And it is that balance of that encouraging, well, you're clear to do it. We'll give it a try, right? Yeah. And have someone there to help you for the first time, but like be involved in it. Like, okay, that went well. Let's try again a little bit more. And even just that belief and faith in your body to heal is so massive, I believe.
Yeah.
And if you don't believe your body is going to heal, you're never going to feel like it heals.
Well, and some of that comes from the patient.
Yeah.
A lot of it comes from the providers they interact with, unfortunately, or fortunately, right?
Yeah.
Good or bad.
Yeah.
I've just met some who maybe they just lack education, right? I don't know what their motive is or whatever, fear-mongering. And there's a provider that told my cousin when he was 25 that if he didn't get treatment with them, he would be paralyzed by the time he's 30.
Man,
and he
it's a
gave
strong
him
statement.
A 28-page document, and at the bottom, every page said you will be paralyzed by the time you're 30 if you don't get treatment.
Oh, man.
He's over 30. He's fine.
Yeah.
He never got treatment from them or anybody else. Like, it was just fear-mongering, right? Yeah. And so, or an MRI, right? Oh, you're hurt? Let's give you a steroid shot and get an MRI.
Yeah.
Like, maybe let's not be so aggressive right away. The healthcare triangle pyramid, right, is upside down.
I agree.
We hurt and we get medication. It didn't help. Well, yeah, because you're not fixing anything. And so then you get injections, then you get surgery, and then you go to PT because you got surgery. You need to recover. Mm-hmm. Go to physical therapy first.
Yeah, I love that. And what do you see in people who do early physical therapy? Even
in the worst case situation, they recover faster.
Okay.
So blown rotator cuff. Yeah. I tell them do 2 to 6 weeks of prehab is what we call it, right?
Okay. Yeah.
You're going to need surgery because of the type of damage.
Yep.
Come work with us.
Yeah.
And then your recovery is 50% faster after the surgery.
Crazy.
Right?
Yeah.
And right now I hurt because of torn damage, but I can function here. Well, now you're going to fix that and have worse pain, right, from the surgery.
Yep.
And now you don't want to move at all. So why not get some of that movement going beforehand?
Yeah.
Right? And so, yeah, I've seen a lot of that.
I love that. And I've had a lot of experiences of doing, rehab prior to surgeries. And I've seen the studies on it. It is extremely beneficial. And I can also say mentally, it is so frustrating to be like, let me push and get and have all this pain and know that I'm going to lose this motion in a little bit. I'm going to lose this strength again in a little bit, right? And so, I mean, what do you tell people who kind of are experiencing some of that, hesitation with that mindset?
Mean hesitation to go get the surgery, or what do you
hesitation with the rehab prior to the surgery?
So I'm misunderstanding the question. You're good. So they're hesitating to do the rehab before surgery because they're afraid to make the damage worse? Or
mostly it's more just that frustration because they're going to lose the motion again and
why
the
try
strength
now?
again. Yeah.
I see what you mean.
Yeah, it's like you're experiencing a lot of pain and frustration prior to the surgery for what, right? Yeah.
Yeah, no, I totally get that. It's educating them about how the body works. Okay. Your most powerful system in your body is your nervous system.
Okay. Yep.
So when we want to change something, you can change the joint, which can't do anything on its own. It just is. Mm-hmm. You can change the muscle, which can do stuff. It moves the knee, right? Mm-hmm. And it exists as its own, plus it moves other things.
Correct.
Which is better than just treating a joint.
Yeah.
And then even better than that is the nervous system, because the muscle can't contract without a nervous system. Mm-hmm. So we're waking up the nervous system. We're making it aware, communicating to all the different muscles in the area so that you're primed to recover faster. Your body will experience less pain because you worked on it beforehand.
I love that.
And it says, I should be moving. Instead of, I haven't moved for 20 years. I got a surgery. Now you want me to move and you damaged me first? Let's get moving first.
Yeah.
And as physical therapists, we know what you're safe to do to not make the injury worse or damage your body, but still prep you for that surgery.
I love that.
But that ties into the other side of it that we didn't talk about, was most injuries don't need the surgery. So physical therapy is recommended by every study, by every institution, the AMA, whatever.
Yeah.
And even your insurance. I want to get an MRI. Well, I have to go to 6 weeks of PT first.
Yep.
Why? Because the insurance doesn't want to pay for stuff.
Yep.
There's two components. One, are they just trying to make it a barrier so that you're going to give up?
Yep.
Maybe. But also they know from the research you'll get better without the MRI in a lot of cases, right? The most prevalent would be back surgeries.
Yeah.
Have you heard about the study on this?
Yes.
So 92% of back surgeries in 2016, I haven't read the new updated numbers, 92% would have done just as good or better with physical therapy instead of surgery.
That's insane.
$6.8 billion industry back then. Yeah. Who knows what it is now?
Yeah.
I haven't looked it up. But
yeah, that's wild.
That's crazy to me.
Yeah.
So less surgeries, less MRIs. Well, now, MRIs are sometimes still needed. I'm not attacking that by any means. Less opioid addiction because you didn't need the opioid as long.
Yep. That's wild. So, I love that.
Obviously, I'm quite passionate about it. Sorry.
No, I love it. The power of the body, like it is. It's insane, right? And again, like you're saying, right, that connection of nervous system. And I do feel like sometimes, PT is very like, oh, they'll make it move again, right? And it's like there's so much more to it than a lot of people even recognize or realize. It's wild.
Majority of people who come in, do you know what PT is? No. I don't know. You'll make me exercise. Maybe. Maybe not. Or the worst is when they're like, you're a PT, right? Will you massage me? It's like, I don't do massage.
Yeah. Kind of way too much school for that.
Yeah, we do soft tissue work.
Yep.
We do scraping and cupping, but people don't know what PT is, unfortunately.
Yeah.
Which is what we're really pushing right now, is get people to recognize it.
That's cool.
33% of people who get hurt or go see their doctor for a musculoskeletal condition.
Okay.
33% of the people who see their doctor are musculoskeletal. Okay. I said that totally backwards.
Okay. 33% are musculoskeletal.
So they're going for a cold, they're going for a rash. Yep. 33% of why they see their MD, their primary care provider, is musculoskeletal.
Okay.
Who's the number one experts for musculoskeletal? Not PT. Orthopedic surgeons.
Okay.
But you're not going to go to an orthopedic surgeon because you sprained your wrist.
Yeah.
Right?
Yep.
Who's the second best? Physical therapists. So we're going to our MD who might not even, some of them don't even know what PTs do, right? Or they don't know how to refer because they don't know how to diagnose. They're busy looking at rashes and dealing with viruses and stuff, right? It's just not their wheelhouse.
Yeah.
Well, in Utah, PTs are primary care providers.
That's so cool.
So you can go straight to your PT
with
any musculoskeletal thing. 33% should be going there.
That's amazing.
And this is extremely important because our doctors are being overrun.
Yes.
So me telling this, doctors out there aren't going to go, oh, you're stealing my work.
Yeah.
No, they're like, thank you,
Please.
offload me, right?
Yep.
Some of them don't even know what to do with it. Some do.
Yep.
Some are really good at it.
Yep.
But they're overwhelmed. Mm-hmm. Utah is the lowest ranked state.
Okay.
For primary care provider per capita.
Interesting.
So they do it compared to 3,500 residents to one primary care provider.
Wow.
We are the lowest ranked in the United States.
Wow. That's insane.
Right?
That's a little terrifying.
Super terrifying.
Well, and our growth is just getting bigger and bigger.
We're the second fastest growing state. Idaho's the fastest. We're the second.
Wow.
Isn't that crazy?
It's going to be a huge
People
problem.
are moving here and we have no doctors. So Utah passing this bill, you get hurt, you need to see your doctor. You're like, my back's hurting, my neck's hurting, my shoulder hurt.
Yeah.
Go see your physical therapist.
Yeah. When you guys can order now some imaging.
Yeah, since 2018, we order X-rays, MRIs.
That's huge.
And we can tell you what the findings are too. Yeah. Like we can explain it to you.
Yeah, that's amazing.
So, anyway, I'm not trying to advocate PT, but just helping take away those barriers to care.
Yeah.
And people feel stuck. They feel alone. They feel not heard. My doctor said I'm fine.
Yeah.
But I don't feel fine.
Yes.
I can't work. I lost my job because if we wait too long, these things lead to very serious situations.
Correct. 100%. No, I love that. And I think it's so important, like getting into early PT like you're talking about, and even just getting that evaluation early on. Very, very important. And then continuing up with that, even if you've seen your provider, your doctor, you've had surgery, whatever, what I've come to realize, and a lot of my clients have as well, PTs are the people who see you day in and day out. They get to see you functionally move, right? The doctor who sits there and looks at you for 5 minutes in the exam room doesn't always have as much of an idea of what's going on, really, as much as your PT who's watching that happen, again, like, potentially multiple times a week. They get a lot more data points in general than the physician to be able to work under.
We get that hour, right? 45 minutes, hour to evaluate and see what's going on. And we still get it wrong sometimes. Mm-hmm. They call it practicing medicine, right? Because we're practicing. No matter how good you are, 60 years in, you're still practicing.
Definitely.
And we'll keep working on it. And then the next session, you got to adjust. You're like, wow, I was wrong. Let's do this instead. Yeah. And that does happen. But for a doctor to get it right in 10 minutes is putting way too much pressure on them. That's just not fair.
Agreed. Yeah. It's not realistic oftentimes. And if you don't have that member on your team who's seeing you on a frequent basis, I'm shocked that people are able to recover from complex injuries. Yeah. Like if they even are able to. So I even just think that importance of, having them be hands-on and eyes-on frequently is massive, and
be willing to get multiple opinions if needed, and your PT might be wrong, and I have no problem admitting I'm wrong sometimes.
Totally.
And I'll tell people this is what I think is going on, let's get another opinion.
Definitely.
I had a patient recently I sent out to an orthopedic surgeon, and the orthopedic surgeon's opinion I disagree with. Yeah. Which is fine. We're just two.
Of course.
I said, can you go see another orthopedic surgeon?
Yeah.
So now there's 3 opinions, right? I still haven't heard back, so we'll find out what the other one is. But if both surgeons disagree with me, I'm probably wrong, and that's okay.
Definitely.
But the first one was a little bit too far off from that. I'm like, I don't agree with the answer was surgery. And I'm like, for what?
Yeah.
Anyway.
Yep.
So advocate for yourself.
Definitely.
Get more opinions if you need to.
Definitely.
And interview your providers.
Agree with that.
We are totally down for anybody to come interview our PTs. Do I even want to work with you?
Yeah.
Physical therapy, healthcare in general is an art.
Yes. Agreed.
Do you like classical music, hard rock, rap? What's your genre?
Probably pop.
Pop?
Yeah.
Okay. So let's say, I like most music, but let's say I hated pop.
Okay.
And you're my MD.
Yeah.
And your style of healthcare is pop.
Yeah.
And I come in and I'm like, you're a smart person.
Yeah.
You care.
Yep.
You got good bedside manner.
Yep.
But I don't like pop.
Yeah.
I'm going to go over here.
Totally.
That's okay.
Yeah. There's nothing wrong with that.
The healthcare providers that sing to you.
I love that. What do you think people should be looking for in providers, whether that's MDs or PTs?
I love that. Such a good question. I'm biased. This is my biased opinion. Please
I love it.
Ask other providers, right?
Yeah.
What should I be looking for in PT? What should I be looking for in MDs? Yeah. Ask more people. Don't just go off of what I'm saying. You need somebody who hears you and listens to you, doesn't cut you off. That's huge.
Agreed.
Then they consult with you on the plan of care.
Yes.
Okay, which is both sides. Some people are so confident in what they're doing, or they don't have enough time to stop and consult with you, whatever. Sometimes it's the system, it's not the doctor, right?
Totally.
But also the patient. It's your job too. I will say, what do you think? And they're like, well, aren't you the doctor? Oh, sorry, I shouldn't be so mocking. But that's one of my pet peeves.
Yeah. Yeah.
I am the doctor. I do know what I think is best, but I have to get you to collaborate with me because it improves your chance of outcomes.
Yep.
And what if I am wrong? Because I'm still human.
Of course.
So those are the two biggest things.
Yeah.
Then when it comes to PT specifically, do they spend time with you? And do they give you things to help yourself?
Okay.
So a home exercise program.
Yeah.
And did we talk about your whole life? Sometimes that's not necessary. I sprained my ankle. Well, okay, how bad is it? Do we actually need to dive into how many stairs are in your home, right?
Yep.
But a lot of injuries, do you have kids you have to take care of?
Yeah.
How many jobs are you working? I've worked with some amazing Hispanic women. I don't mean to sound like I'm judging based on race, but they work hard.
Yeah.
Okay.
Yep.
3 jobs.
Yeah.
They get hurt at one of them.
Yeah.
And that affects their other 2 jobs. So we have a lot that we need to dive into.
Totally.
So are we looking at the whole picture? Are we giving you things to be independent? And are we creating a plan that lets you get away from me?
Yeah. I like that.
And I'm assuming it should be similar with other providers, but especially PTs.
I love that. I think you hit on something so important there, right? Again, like the whole life, right? Which not only includes, you know, your work life, your personal life, but also what do you do for fun, right? And I think so many times people get injured and they stop doing things that they love to do, right? Which makes sense. It hurts. It's hard to do. But if you stop doing them, getting back into it is incredibly difficult, right? Because most of the time in PT, you're not rehabbing to go and rock climb, right? You're rehabbing for functional life. But
because insurance won't pay for that. Right? Which is dumb.
It is. But. Yeah. Don't even get me started on that, right? We could go down that trail. But then you never get back into rock climbing, for example, if that's your thing. And there's so much detriment to that for the patients, I think. And so even to be able to go, if we're using the rock climbing, go and watch people, right? Go and belay if you safely can. Stay involved. That's huge for the patients. And I wish more providers would push people into that. And I wish more patients would really try to figure out how to make that work.
And that's something that student PTs, student MDs need to understand. It took me too many years to learn that component of it. In that I'm not just here to give you medicine. I'm not just here to give you exercises. I'm here to be your provider. What's your diet like? How's your sleep? How's your relationships at work, at home? Because those are all factors that can tie into this.
Totally.
Right? Now, do we have enough time to cover all of it? And there's a lot to dive into there.
Yeah.
But you have to treat people as humans, and you can't put a ceiling on their recovery.
Agreed.
You don't need to rock climb again.
Yeah.
I hate that when people are like, you're never rock climbing again. You're never going to run again.
Yeah.
Why are you putting a limit on them?
Yep.
Right? And say, based on this injury, I've seen a lot of people have a hard time getting all the way back to rock climbing. Can you boulder? Can you go hiking? It's just we need to follow through with these other options to find other hobbies and create a full life instead of just cutting them off.
I totally agree with that. No, I love that. And I think you bring up such an important point with that too, on just being able to getting into, right? Like not limiting your patients. Like I said, I think that was great. But I mean, so I had my experience. I had 11 hand surgeons tell me, you will never work as a firefighter paramedic again. Like you're never doing that, right? And for me, I have the personality where I'm like, bet, like I'm gonna come and drop you off some cookies when I do. You know what I mean? Like, you know, like I'll show up in my rig one day and you'll be there, and I'm excited to watch your face, right?
Just wait till you're in the fire and I'm the one pulling you out.
Yeah, and I'll walk up, sorry, sir, I can't do this. You know what I mean, right? Like that's just challenge accepted for me, and not everyone's gonna have that, right? But even just to be able to say, like, I don't feel like anyone's ever at the end of their recovery. I actually have a good friend right now. She had 10 years. She had severe CRPS in her hand to the point which they were talking about amputation. Like she was just at a point she had no quality of life. It's been 10 years since her injury, and she can now wiggle her index finger. And 10 years, she had zero movement. And it's like, it's wild, right? And I'm not saying everyone's going to have that experience, but do you ever know, is recovery ever done? And I don't believe there's very few instances in which that there's few. There is some, right? And there is a few, but it's few and far between. And what that looks like may be very different, and how you do things may be different, but can and can't, I think, are very strong statements that providers should be very, very careful with.
Yep.
Yeah.
Oh, I 100% agree.
Yeah, it's insane
to me. Don't put limits on that. And give smart advice, but leave it open-ended.
Agreed.
And, don't let your ego get in the way of helping people.
Agreed. Yeah. And I think a lot of it comes down to time for them. Like, I don't have time to look at that with you to help you figure out what that looks like. I don't, I'm not so sure about this treatment, so I don't want to do it at all. Right. Like, and that comes down to time, which again, I think goes back to a lot of what you're saying. They're very overextended. There's a lot of providers who they don't give good time with their patients. They don't communicate well with their patients. And I don't believe that that's their intention. They didn't go into the field with the intention of wanting that, right?
I want to be overworked and chart all the time.
Yeah.
And barely work with people. Like, that's not the goal.
And I want to not listen to patients. No one got into it, right? They got into it to help people at the end of the day. And I think kind of what you're talking about, there's some big systemic issues that are going on in our society that are leading to these individual problems that are really affecting our patients.
They are, but it's getting so much better.
Yeah.
Right? Like, people... And it depends on where you go.
Of course.
And systems like your organization help, right? Make a difference for people to have somebody to lean on. Yeah. And if they can find the right providers, that's why I say interview. If you're seeing another PT, call me. Mm-hmm. I will chat with you for free because you're going to stick with that PT. Mm-hmm. Even though you're in St. George, you're in Texas. I can't treat you. You're in Texas, right? Yep. Call me. I'll chat with you about your case and what things you should look through for your PT.
I love that.
There are providers out there who will advocate for you.
I love that.
Get that second opinion, and then find somebody who's able to, whether it's because they're willing to or because they're in a system, a structure, a company that lets them spend that time with you.
I love that.
And so there is hope. And there's help. That. And mental health is appreciated now. Yeah. I think mental health in injury is more appreciated now.
I would agree.
But it's people like you, like other providers advocating for it. That's why it's going to keep moving forward. I don't think we're the first ones who are fighting this. There'd be zero momentum. Yep. Right? Yeah. I think there's momentum. And any other providers, because with our podcast, which we're going to steal this and throw it on ours too.
I love it.
But on our podcast, we speak a lot to our patients if you're in a car crash or whatever. Yeah. But we speak to other physical therapists, chiropractors.
Cool.
So those PTs and chiros get on board, get behind this, and guide patients. Definitely. It doesn't have to end in dollars in your pocket.
Agreed.
Don't have a scarcity mindset. Yep. There are so many people, abundance mindset, so many people who need you. Injury prevention, whatever it is, whatever it looks like. Agreed.
And and with that too, like, you don't have to be the specialist in everything, right? If you're the PT, it's okay for you to not be the person's therapist, right? Like, you don't have that schooling with that. You don't have those resources, and you can recognize a need and refer, and it doesn't take anything away from you. Like you're saying, right? It's an abundance mindset with that. And I think being able to recognize what do our patients really need and how do we work in a very collaborative system. And, that's where, this nonprofit, we're stepping in and trying to be that resource for a lot of providers connecting. We see this patient who's struggling, right? Well, you continue to treat the patient in this, and we'll take this aspect from you, right? And it comes down to collaboration 100% of the time, I think.
I love that. I'm glad you said that. We'll chat after, but I've got a couple doctors I need to connect you with.
Yeah, I'm excited.
Really That's smart.
There you go. Any last kind of words of wisdom you have for any patients that might be struggling out there dealing with that kind of mental health side of recovery?
Positivity. Don't play the victim, because the research I've studied says that if you play a victim, you will fail. Mm-hmm. You want to get better, then tell yourself you're going to, and then advocate for yourself.
Love it.
So it's true. You probably are a victim, right? You got hurt.
Yeah.
Maybe you've been ignored. Maybe you had a doctor who said you're exaggerating your pain because you're a woman.
Yeah.
Right?
Yeah.
Those things happen.
Oh, yeah.
That means you're a victim. Move on from that. You're a victor. Go find a different doctor that's going to help you win and hear you and give you different advice.
I love that. I love that. You're a victim. You're a victor. I love that. That's amazing.
Yeah, so it's your mindset. And find people who understand that the mental component of healing, of healthcare.
Yeah.
And get them in your corner.
I love that. Well, thank you. It's been a pleasure talking to you, and
I feel like we could talk for hours.
I do too. Michael, I feel like we have so much more we could unpack. So
yeah, for real.
I love it. Well, thank you. I appreciate it.
Thank you. This has been great.
Awesome.